Did you know that 90% of adults have herpes simplex 1? And 1 in 5 Americans have herpes simplex 2. Herpes is a virus that is most often spread during vaginal, anal, and oral sex. There are 2 types of herpes simplex. Herpes simplex 1 usually appears as small blisters around the mouth. Herpes simplex 2 typically forms herpetic lesions on the genitals, buttocks, or rectum. They are transmitted via oral secretion or genital secretion contact, which leads to the 3 stages: initial, incubation, and latent for both viruses. Vesicles form in the initial phase. They become painful ulcers that crust over to heal. The incubation period can be from 2 days to 3 weeks after exposure. The symptoms may include headache, fever, flu-like symptoms, joint pain, swollen lymph nodes, difficulty urinating, nausea, and vomiting. The latent stage is where the virus remains dormant in a bundle of nerves at the base of the spine. Recurrent outbreaks are common, but are said to be shorter and less severe over time. Herpes simplex 1 can be transmitted as herpes simplex 2 if oral secretion comes in contact with the genital area. Mothers can also pass herpes simplex virus 2 onto newborn babies during childbirth. Kissing a baby postpartum can transmit herpes simplex virus 1. HIV patients are at risk of contracting herpes simplex virus due to their lack of cellular immunity. Even though herpes is incurable, there are treatments that can reduce visible blisters. The preferred treatment for flare-ups is acyclovir at 800 milligrams 3 times daily for 5 days. For the initial herpes simplex virus outbreak, acyclovir at 400 milligrams 3 times daily for 5 days is recommended. Herpes simplex virus infected women should be referred to an obstetrician or gynecologist if planning to become pregnant or if they are already pregnant. Education is imperative to a patient and their partner as part of treatment for herpes simplex virus 1 and 2. It's also recommended that they have an STD screening to identify herpes simplex virus. So you might be thinking, how do I prevent myself from getting herpes simplex virus? Practicing abstinence is key to making sure that you don't contract herpes simplex virus 1 or 2. Other methods such as safe sex and antiviral suppressive therapy can also help prevention. Thank you for watching!